Seated machine row. Perform a row on the machine by pull back. Make sure that the back is straight and the seat is adjusted to fit the person's comfort. Do 3 sets of 10. Okay, the next one is cable pulls front of body. Have the person face the cable machine with the affected arm holding the handle for the cable. The patient will do flexion and extension of the shoulder with palm facing down and the elbow not bent. This should be done in a slow motion, 3 sets of 10. The next one is cable punches. The TheraBand should be at waist level and the patient facing away from it. The person should stand with one leg ahead of the other. Depending on the side that is injured, the other leg should be out. With the hand grasping the TheraBand, the person begins at the waist level and bends the elbow at 90 degrees. With elbow remaining near their side, they slowly punch forward, slightly raising the arm in a forward upward motion. The hand should reach about neck level with their arm mostly straight. Patients should not bend at the waist and remain in upward position. 3 sets of 10. Shoulder press / military press, dumbbells or machine. The person standing with dumbbells in each hand, they bend their elbows and raise them in upward arms to shoulder height so the dumbbells are at head level. The patient then pushes the dumbbells up until the end of the dumbbells touch slightly directly overhead. Then they slowly lower the dumbbells back to head level. The patient should have their back straight, 3 sets of 10. Next is the dyno disc balancing for shoulders. Have the person in a push-up position, however, both hands should be on a dyno disc. Keep elbows straight and the person must try to balance. 3 sets, but for 40 seconds on each. The next one is planking on an exercise ball. Yeah.
Equipment malfunction. Run.
Have the person in a planking position with their feet on the floor and their forearms on the exercise ball. Good job, Bree. The exercise ball in the form of a V. In the form of a V. Okay. The person should hold themselves up while balancing on the ball during this process. No, keep holding. 3 sets for 30 seconds each. Next one is incline push-ups. The person should be in a push-up position with feet on a bench or an elevated object and hands on the floor. The person should do a push-up in this position going far down as possible. 3 sets of 15. The next one is lateral moving push-ups. The person is in a push-up position. Make sure they go down into a push-up with the elbows at 90 degrees, then come back up. Then they will bring their hand next to the other hand and then move the other hand out so they are moving over and can do another push-up about 5 lengths. Do 3 sets of 10. The next one is ball throwing / catching. With a weighted ball, throw at a patient in different directions. The patient must catch it in both hands to make it harder for the patient and to make it harder, have the patient stand on one leg. 3 sets of 20. The next one is side planking with arm raises. Have the person lay on their side with the arm underneath, bent at the elbow to support the body. With the arm and cord, they raise their whole body off the ground except the forearm and outside of the foot. With the other hand, it should be raised straight up to be held. 3 sets for 30 seconds.